Welcome everyone to today's webinar, Future-Proofing Your Health System, Choosing a Communication and Logistics Platform that Scales in and Beyond the Pandemic. On behalf of Becker's Healthcare, thank you for joining us. Before we begin, I'm going to walk through a few quick housekeeping details. We will begin today's webinar with a presentation, and we'll have time at the end of the hour for question and answer. You can submit any questions you have throughout today's webinar by typing them into the Q&A box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's session to access the recording. If at any time you don't see your slides moving or have trouble with the audio, please try refreshing your browser. You can also submit any technical questions into the Q&A box. We are here to help. With that, I am pleased to welcome today's presenter. Joey Branton is the Senior Vice President of Strategic Initiatives at Pulsara. Joey, thank you so much for being here today. I will now turn the floor over to you.
Thank you so much, Molly, and I want to thank Becker's for having us on the webinar today. And I want to talk specifically about future-proofing your health system. So how do you choose a communication and logistics platform that scales in and beyond the pandemic? I think we've all learned in the largest pandemic in our lifetime how healthcare leaders are trying to figure out how to use unified communications and logistics, not only to manage the COVID-19 crisis, but also lay the foundation for a new reality in healthcare, including dismantling communication silos between disparate care teams, have a single source of truth for patient care coordination, and how do we scale systems of care effectively in both day-to-day use as well as pandemics and other disasters. So at Pulsara, we like to talk about connected teams and systems of care that scale. By systems of care that scale, we mean using the same system daily that can scale easily for local, regional, or national stress events or emergencies. We certainly have all learned during the pandemic what it means to have large areas of the country or regional areas and rolling epicenters of the pandemic roll through our communities, stress our healthcare system to their limits, and not be able to really effectively care for even normal patients in our healthcare system. So at Pulsara, we like to talk about the traditional patient journey, which we all know in healthcare and we all experience throughout our careers. And as you can see here on this slide, you see all the silos that exist in the current healthcare. They exist in the first responder space, the ambulance space, hospital, ambulances that go between hospitals for transfers, and of course transfer centers and hospitals. Each one of those red lines represent a communication channel that opens and closes. And every time it opens and closes, it ends. So just imagine how many times those channels open and close. It involves radios, telephones, pagers. Still fax systems are being used across the country in many settings. And every time those communications open and close, they present the opportunity for miscommunication, communication errors, and loss of effective and efficient communication in healthcare. So what we like to do at Pulsara is talk about how we can change that traditional patient journey. Instead of one-to-one communications, we talk about how you can just simply communicate by doing three things in just 3 steps. Step number 1 is you create the channel. At Pulsara, we like to call it the Pulsara red line. So every patient has their own discrete event. You create that patient channel. Step 2 is you build your teams, and you can build those teams dynamically on the fly as you need for whatever team members or organizations need to be added to the patient channel. And then step 3 is you just simply communicate and you track that patient's care and that actual patient themselves through the continuum of care. On that red line, we're also able to add in things like data in. And examples of that would be integrations with cardiac monitors so that you now have the same ECG being seen by everybody who's on the team, no matter where they are. We also have integrations with some of the new AI tools that are out there, particularly in the stroke world. And then, of course, we can take the data that's put on the Pulsara red line and we can send that data out to electronic patient care records in the EMS space, the electronic health records in the hospital space, or any other data systems that the patient's communications need to be added to. We talk about network communications at Pulsara. That includes things like synchronous communication, which is live video. Imagine live video including group video and live audio. We also have asynchronous communication on the platform. So imagine instead of waiting for somebody to answer your radio call or your phone call or take a report that person may never take care of the patient, instead you drop an audio clip of your complete patient report onto the Pulsara patient red line, and it's available for everybody who is going to be in the continuum of care of that patient. You can also have GPS tracking, so you have estimated times of arrival. You can put data in. You can take pictures of anything that you need to and put them on the patient channel. You can do team messaging on the patient channel, and of course you can also do documentation as needed on the channel. All of that also being able to be integrated with things like cardiac monitors and artificial intelligence. So as you see here, you see a normal communication channel that we see in healthcare. It's a one-to-one or a one-to-few. And every time there's a breakdown in there, the breakdown in communications about a single patient event fails to some degree, or the efficiency is limited. So instead of that, we create a many-to-many, multi-channel communication path using Pulsara. So the strength is the sum of the parts. In network communications across organizations, of course, we're talking about distributed teams, especially teams across organizations. One of the things we always struggle with is communications across organizations that don't have the same data systems. So you don't have a data integration, but yet you're trying to communicate effectively about a patient case or a patient care or something that's going on with the patient, and yet the data systems don't speak to each other. And it's also important to understand that those network communications are important for unscheduled, undifferentiated patient events. So you want to be talking about the right patient, looking for the right resources, and getting that to the patient in the right amount of time. And then, of course, the time-sensitive emergencies are very, very important. The Pulsara solution has been used for many years in the time-sensitive space. They're low-volume cases, but they're very high impact. They have a lot of morbidity and mortality around them. And so the time-sensitive emergencies are very important to communicate effectively across organizations. And then, of course, there's transitions of care. People are going between facilities, whether you're load balancing a region that's underserved, or whether there's mass casualty incident of some sort of man-made or natural disaster. All of that is important to have network communications across organizations and available to everybody who needs to be on the patient channel. So real-time communications across healthcare industries. You create a dedicated patient channel, as I said. You build your team, entities, EMS, hospital, et cetera. All teams or individuals that need to be involved in the patient care can easily be added to the case. And then you communicate. You can use group messaging, audio clips, images. Phone and video calls, including group video, as you see here. And then notifications of important events. So we have push notifications that are built around your own team structure, your own team alerting, that allow for that seamless communication. So it's one system of care, all team communications on one platform that can scale from trauma to cardiac arrest, to STEMI, to stroke, to sepsis. Any patient, anytime, from anywhere. So we also have the ability for you, many patients are in transitions where even the first responders, maybe the EMS, or even as a walk-in, they don't clearly identify as to what they may fall into as far as a time-sensitive emergency. So Pulsara provides a general patient module that also allows you to flex the platform along all sorts of lines of care, whether it's pulmonary embolism response, surgical call, OB delivery, transplant, emergent pacemaker, or anything that suits your organization's needs. So how can the cases be started? And this is really important because they can be started for any patient at any time from anywhere. So EMS, of course, to hospital, inbound EMS, a hospital can start a case on behalf of an EMS agency. walk-in emergency department patients, inpatients. As we all know, the workflow for inpatients who have time-sensitive emergencies are often a little bit out of step with the patients who come in by EMS or walk into the emergency department. So it's important that those patients all get the same effective and efficient communications that's available using team communications. And of course, spoke-to-hub transfers. We all know how hard it is sometimes to get spoke-to-hub transfers done in our healthcare environment. It sounds simple. Everybody thinks it's simple until they're trying to make that transfer. And in fact, there's many, many times that the spoke hospital struggles to find a facility that can effectively take care of their patient or has the capability and capacity to take care of that patient. So on the platform, you're able to do consult and transfer, understand what's going on with the patient that's trying, the spoke facility that's trying to transfer you a patient, and have real-time communications about that case. So we're supported on all modern mobile devices. So think iOS and Android in the mobile space, and also for every modern browser, we're available on the desktop. Pulsara HQ is our desktop version. As you can see here, you can see that it gives you the summary of all the patients who are coming into your institution or whatever service you're covering. And it shows the patient list here. And then you can also go in and you can see the patient summary view. Flowchart notes is the ability of the Pulsara platform to provide some documentation that can be configurable by each agency. So the flowchart notes is something that you would have control over. You can create these notes. They're editable across the organization and available to anybody that needs to add to or augment the flowchart note. This is the mobile version of flowchart notes. It's available on mobile just as it is in Pulsara HQ. And of course, this is the Pulsara HQ view. So everything that you can do in the mobile environment, you can do in the HQ environment, all the team chat, images, look at everything that you need to look at that's been put on the channel. And Pulsara Patient is a way for us to actually add a patient or an approved family member to the patient channel in order for us to communicate effectively with them. You simply just put their phone number in the platform. It sends the patient or their appointed person a text. They launch that text, and you have the ability to have a live telemedicine visit consult with that patient or their family member on demand. One of the things that's really been helpful during the pandemic is the ability to reach out and touch people who don't necessarily have primary care providers, but they're calling hotlines or they're calling 911 and they're just looking for advice. We're able to effectively use this tool for that purpose. This is our summary report that you can look at when you're looking at each patient event. And as you can see, it includes all the interactions that take place for every patient event, including timestamps, images, ECGs that have been uploaded via our integrations. You can also take that and export that. And then you also have the ability to do deep linking. It's a common tool that we could actually, staying on the Pulsara platform and doing the same type of communications you're doing for every patient, you can actually deep link out to other applications, looking at things like images, like vital signs or images. Our public API can be leveraged for seamless experience for the patient event. So how do you build your system using Pulsara? Any organization can create that dedicated patient channel. They can then add their internal teams as needed. Think stroke teams, trauma teams, sepsis teams, cardiac arrest teams, STEMI teams. If that facility needs to add another facility for either consult transfer, then they can seamlessly just add them to the channel as well, all seeing the exact same information that's been communicated about that patient since the beginning of their case. If they need to activate their internal teams, likewise they do the same using the same tool. And you can continue to do that for as many organizations as you need to. Ultimately bringing everybody onto one communication channel about a single patient event sharing and communicating about everything that's going on with the patient. Teams and team members are 100% configurable to your organization. We can take the platform and make it work for your current clinical workflows and the way you want to alert and notify your teams. Pulsara Manager is a way for you to manage the system that you're using for Pulsara to manage your patients. It includes the ability to look at all the patient cases that have been involved with your organization. And then you can go in and see the details of every one of those cases. As you'll see here, there's some timers that are set there. Those are metrics that your organization can set based on your own metrics around time-sensitive events. Then, of course, you can export that out as well. And everything that gets put on the channel is available in that export. Pulsara Manager also allows for you to do a data export using CSV to put that out into Excel or any way that you want to consume it for analytics. And as you can see, there's an enormous amount of detail that you can extract out of each one of those patient events. One of the most important things we think that Pulsara provides is the immediate feedback loop to providers. Everybody who's been involved in that patient's case has the ability to get instant feedback on what's going on with that patient and what the outcome was. Imagine a day when everybody in the case got to see exactly what took place with the patient. You're not waiting for weeks or months to know what happened with your patient. You get that immediate feedback loop. It also drives the adoption of better clinical practice for those folks because they're able to actually understand the outcomes. And so we just provide a platform for that communication to take place. So there's a lot of interactions that can take place with Pulsara. We'll start with EMS to ED. So in the traditional space, the EMS starts the case. They're going to include a hospital. They're going to use all the things that we talked about, synchronous and asynchronous communications. And then in time-sensitive space, the EMS to ED to downstream teams. They'll start the case, one continuous patient channel, the time-sensitive alert to the hospital, who then passes that time-sensitive alert on to their teams. They're flexible time-sensitive workflows, so you can flex them any way that you need to, starting the case by EMS, adding the hospital, for any one of the patient syndrome modules that we have, stroke, trauma, STEMI, general complaint, cardiac arrest, or sepsis. And then, of course, you can use all those communication methods by anybody on the channel. And you can add the downstream teams as needed for the complete care of that patient. There's also the ability to use, for EMS to use it as a collaboration hub. In this example, you'll see that EMS is starting a case, one continuous patient channel. They're going to consult their medical control or maybe a medical operations coordination cell. They're going to bring in additional resources. Maybe it's mental health. Maybe it's on-call EDs. Maybe it's public health. Everybody can be added to the channel as needed. And then you can determine what you're going to do, either add a destination or do other sort of alternative care. One United Care team. Interfacility space. The case can be started by one hospital. Start the patient channel. You consult on a transfer center or an access center, and maybe all you want to do is consult and have a conversation about the patient or show the patient using our video telemedicine feature. And then you can add hospital teams, consultants, whoever may be needed, the house supervisor to arrange for the transfer. You add the destination, and you've got a seamless interfacility experience. Every patient has their own dedicated channel. Sometimes there's complex out-of-hospital use cases. So a 911 call is initiated to a medical control or medical operations coordinating cell. Start the channel, add social services, medical control, supervisors, whatever's needed to be added to that patient's channel in order to effectively take care of them. And then, of course, if you need to include the patient or their family in that experience, you can do that as well. So imagine that you're going to add a transport on that particular case, completely optional, or you add a destination if necessary. Pulsara 1, consult. You can consult this. So you start a consult with a hospital or a medical operations coordinating cell. You add the resources as needed for collaboration, medical control, supervisors, anybody that needs to be added to the patient channel can be added. And then you add a destination. The ET3 model that's common now, it's being promoted by CMS, of course, is another way that Pulsara can help form effective communications. You can do a consult using Pulsara for the ET3 type patient. You have all the options that are then available. You can treat them in place via that telemedicine consult with a practitioner. You can take them to other destinations, to the emergency department, or even a virtual care center as a consultation. And then, of course, medical control. EMS can use their own medical control, start a case, involve their medical control, add the resources as needed, and you have all the options. Discharge, no transport, other destinations such as urgent care, or a destination facility, all using the same tool. So we've learned a lot in the last couple of years about pandemics. And so one of the things I wanted to pivot to is, so all of these things that we've talked about so far are your standard use, everyday use of Pulsara in the healthcare environment that we all experience. But what about the pandemic? So how do you prepare? How do you mitigate? How do you respond? And how do you recover from an event such as the global pandemic? And of course, there are many things that are involved in that. There's data, logistics, communications, and all of those things have to be figured out. How do you connect them to prepare, connect, and respond? So many of you will be familiar with this. The Medical Operations Coordinating Cell is something that has existed for some time in the country. They really came into their own due to the pandemic because they really performed these functions, moved patient staff to the right person, to the right provider, at the right time, in the right way, to improve patient well-being. So what we've learned, I think as all of us have learned in the country and across the globe, is that the airline industry already had this figured out. So they have standardized communication platform. It's immune to airline affiliation, destination, or location. And of course, they have 5,000 airlines, 17,000 airports, 36 million flights, and over 4 billion passengers annually. So how can we do that in healthcare? We have to do that because, like air traffic control, healthcare response in the pandemic needs to be immune to EMS, public health, hospital domains, and origination or destination location. This is an example of exactly how you can accomplish that. So imagine a world in which your traditional transport patterns are the dotted lines, and yet when somebody calls 911, or maybe they're calling a 311, or whatever the number may be for the COVID hotline, and they're the worried well, and they just want to talk to somebody. Many times we've seen instances where people say, don't send an ambulance, because during the height of the pandemic, people were concerned about being exposed to people who were working with sick people. So you can get the example workflow here of how you can take that 911 call or hotline call. You can turn that into an experience where you can have a consultation with medical control. You can do all sorts of things with dispatch. EMS can be involved if indeed a transport is necessary. You can go to other locations. You can do medical self-isolation, and all the different things are possible because you have this one single tool to facilitate all these interactions across all these organizations and disparate team members and disparate organizations. So we also learned a lot about surge and load balancing. So in the country, there have been, from the beginning of the pandemic to today, there have been these rolling epicenters of surge. And as the surge hits our communities in large regions, many times it exhausts the capacity of both the hospitals from a staffing perspective, a bed perspective, PPE, everything that you can possibly imagine. So how do you mitigate that using a modern communication platform? So local hospitals could always follow their traditional referral patterns. But when the surge hits, they're always looking for additional resources. Many times in a region, they're completely exhausted. But there may be some place either in the same state or in an adjacent state where there are some resources. So they contact these regional medical operations centers that have stood up in response to the pandemic. They query whether or not it's actually appropriate that that patient needs to get out of that particular region. And then they get assistance from something like a state coordination center. State coordination center serves as sort of the transfer center for COVID load surge and load balancing. And then that actual state coordination center or medical operations coordinating cell at the state level can add whatever assets they need, whether it be ground or air assets. They can then contact the other regional medical operation coordinating cells and say, hey, do you have what we need? Here's what we're looking for. And the referring hospital or transfer center can then connect with them and effectively load balance the surge from a particular area, sending patients to areas where there are resources that meet their needs. So the other thing that came up during the pandemic was, well, sometimes you actually can't get anybody out. So all these patterns break down. And so the state coordination center can then effectively create a patient list, what we call the virtual placement center. You can see that the virtual placement center has the basic needs of what each patient that's been placed in there by the area under surge. So then effectively they can communicate that out to receiving MOCCs, who can then communicate on the Pulsara channel up to receiving facilities and say, this is what we're looking for. Effectively, instead of pushing patients out of the surge area, places that have capacity and capability can actually pull from a list of patients in the virtual placement center, adding assets as needed. So that's a system of care that scales. It scales from, in the EMS world, it scales easily from the things that we know to traditional time-sensitive emergencies, ET3 model, routine transports, interfacility for EMS, also all sorts of other EMS operations, first responders, handoff to EMS, regional communication centers, care coordination hubs. And then, of course, the telehealth component provides a very vital link for people to actually extend the provider base that's out there into the communities via telemedicine for either things like ET3, specialty consults, or whatever needs to happen in the EMS space. And then, of course, the emergency management piece is big because EMS is always going to be involved in this load balancing surge mitigation operation, both ground and air ambulances in many areas. And then, of course, alternative destinations. There was a time when nobody could call an ambulance and not go to the emergency department. That was pretty much the only option. But, of course, we now have the options to use communications to effectively find alternative destinations that can effectively take care of patients, decompress our healthcare systems that are under surge, and effectively take care of community health. And then, of course, the ET3 model, community paramedicine, and mobile integrated health are all areas where video and communication, network communications play a vital role. So in the hospital, it also plays a vital role in the normal way that we see patients coming in. Inbound EMS, time-sensitive emergencies, routine transports, mobile integrated health, community paramedicine, ET3, and of course, all other inbound. One of the things I try to call out to people all the time, not everybody who has a problem comes in by EMS to the hospital. So you want the same tool to be used for all your patients, whether they come in from spoke to hub transfer, whether they walk into the emergency department, or whether that emergency or time-sensitive event happens on the floor. And then, of course, all outbound. So you can easily turn those into transfers, transports, and consults on the platform. So Pulsara is the accepted standard-based standard of care. And as you'll see here, you're going to see some statistics that are going to roll across the screen from our customers. There's some very significant things in there, as you can see. The platform is secure and encrypted. It's a mobile app. You can establish a dedicated encrypted patient channel. It includes multimedia, team messaging, live video, images, audio clips, and more. Telehealth made simple. Clinicians can connect with patients or caregivers with each other, regardless of their location. You can convert a phone call to a video call with a tap. And then, of course, it creates that unified patient channel, leveraging network communications across organizations in one unified communication channel. It improves communication, which increases patient safety, reduces complications, reduces length of stay, increases patient satisfaction. And at Pulsara, we always like to say, it's about the people, the providers, and the patients. These are some statistics from US and Australia where our product is being used currently for STEMI care and for stroke care. So Pulsara is to improve the lives of people and those who serve them. Thank you very much. That's the end of that, and then I'll turn it back over to Molly for questions.
Great. Thank you, Joey, for a fantastic presentation. We will now begin today's question and answer session. Attendees, you can submit any questions you have by typing them into the Q&A chat box on your webinar console. Let's get started here with the first question. This attendee is asking, how does all of this information get into the EMR? And what is the compatibility?
So there's a couple of things in there. We have a public API that can be consumed by any EPCR in the pre-hospital space or any EHR or EMR. So we can get that data through that public API out to those different systems. The compatibility is based upon the system that you may be using. So if you're thinking about a commercial system, they would, of course, have to ingest that public API. There would be some integration work, but it's completely doable.
Great. Thank you for clarifying that for our attendees, Joey. This next question is about interfacing with Epic. Specifically, will you share information on interfacing with Epic?
Yeah, I'll say the same thing about Epic that I was talking to about the previous question. We can integrate with Epic. We actually have integration partners that can do that integration specific to any of the major systems that are in the EMR, EHR world out there and in the EPCR space in the ambulance world.
Perfect. Thank you for providing that information. This next attendee is asking, how is the system protected against data breach attempts?
So it's all on the AWS Health Cloud. So we use AWS, which has all of the protection around their health-specific cloud-based services. Specifically, there's nothing stored on the device. So if you think about images, you think about audio clips, you think about anything that would be put onto the platform for a particular patient event, none of that's stored on the device. It's all gone up to the cloud. It's protected by the AWS security. And the other thing is each device that a user has they have to pin in, they have to have their specific username and password, which is issued by the organization that they work for. And so those are the methods that we use for securing the patient data.
Great. Thank you for tackling that one, Joey. Another question here. This attendee is asking, how do the agreements between disconnected hospitals and physicians, et cetera, get managed and stay up to date? In addition to that, who manages those proprietary linkages?
Well, there's a couple of questions there. I would say that there's not a proprietary linkage. Since it's a cloud-based solution, what we're able to do is very quickly and easily onboard people. We did this during the pandemic at large scale. Essentially, somebody can onboard to the Pulsara platform if they're a legitimate healthcare facility, they have a legitimate role, they have a legitimate email address for that facility. We can onboard them. They're going to get a business associate agreement that's assigned with that onboarding process, and that's what stays in place, and that's what enables us to cross organizations easily and very quickly in the onboarding process and the approval process.
Got it. Thank you so much, Joey. Next question here. This attendee is asking, some of our hospitals are already using other telehealth platforms. Would Pulsara be redundant?
Yeah, that's a really good question. We get that a lot, and this is what I've learned basically from our own customers. Is they look at what they've done, and if you think about telestroke systems, you think about telemedicine systems, and you think about the fact that they're usually fixed points of care. They involve fixed networks. Usually involve quite a bit of IT support. They also, to the other question that came up, they require an enormous amount of security. So they're very high cost solutions for institutions. I would say that we don't necessarily replace those. I would say that we overlay those. So if you think about a healthcare facility that may have telemedicine nodes or telestroke nodes in some facilities, but they don't have them in other facilities, they can very easily use the Pulsara solution to scale their current telemedicine, telestroke programs out to facilities that may not be able to support either from an IT perspective or a cost perspective, the ability to actually seamlessly move patients from spoke to hub facilities. So we don't tout that we're replacing those systems, but we are an overlay to those systems, and we augment those systems easily so that it scales easily, quickly, and rather cost effectively.
Perfect. Thank you so much, Joey. Next question here. Where does a system integrator learn more about the API connectivity library for various medical devices?
They could contact us directly. They could go to the website and just contact us directly, and we could either set up something and talk about that with them in a meeting. Great.
Super helpful for that attendee to understand. Shifting gears a bit, I want to ask you about how this model works across regions and states. This attendee is asking, can Pulsara be used efficiently and effectively across multiple regions and healthcare systems in both rural and urban contexts? And if so, how do you incentivize the various clinical teams and different organizations to embrace this model?
So that's a really good question, and the answer is absolutely yes. We have done this in multiple states now since the pandemic started. What we're able to do is we're able to actually connect it, just like that multi-channel diagram that I showed you. You can put a region, you can put all of the healthcare providers, institutions, agencies in a region into what we call our surge management or MedOps platform, and they can easily onboard as they desire, so that essentially it sits there and it just waits. And when the surge happens, they can effectively scale up what they're doing with the Pulsara platform for everyday time-sensitive emergencies to the surge mitigation and load balancing operations that they may be under at that time. We have not found it difficult for people. And I would say this, we've learned, most of us in healthcare have always known this. The pandemic has really shown what we have all known, is that when things break down, when surge happens, people have to come together. Healthcare institutions have to come together. Agencies have to come together, along with public health, along with emergency managers. And what's happened is that we've really all decided and agreed that the only way you can effectively do that is through multi-channel team communications across organizations. And to your point about incentivizing people, the slide I showed about the instant feedback, the ability for everybody who has a place in that patient's care continuum gets not only the immediate feedback at the outcome, but they get the constant ability to know what's going on in that patient channel. If you imagine during the surge that's happening across the United States, many of these patients may stay on this patient channel for days, and there may be constant communications either via chat, video, audio on the channel about what's going on with the patient, whether or not they can be transported, whether there's facilities that have capacity and capability. So it really does incentivize people because it actually streamlines the communications. It breaks down those barriers. You know, somebody mentioned Epic. Well, what if the hospital you're trying to go to doesn't have Epic? They have a different solution. You don't have the same bedboard management solution. You don't have the same ability to activate ground and air assets for the same transport. So the incentive is basically, it's just better.
Absolutely. Thank you for sharing that information. Next question here. This attendee is asking for a bit more information about Pulsara capabilities. They specifically said, Pulsara looks like it focuses on alerting providers and sending patient information between providers. Besides video and audio calls, are there plans to expand to messaging?
There is team chat that's available in the platform. It's a very important part, actually, of the platform. I didn't cover it as effectively in the slide, but one of the things that can happen for institutions and agencies is they can create their own team chat templates, and many of them do. So if you think a STEMI patient, for instance, they'll have a pre-formatted team chat that's in there that says, take straight to the cath lab, bypass the emergency department. These are all things that are possible on the platform now. So team chat is part of the platform. The alerting is part of the platform, and all the other synchronous and asynchronous things that I mentioned before are already part of the platform.
Great, thank you so much. We have a question here that focuses on ROI. This attendee is asking, have you seen this model reduce or recoup costs? And if so, can you provide an example? Also, how might you evaluate ROI?
So if you'll visit our website, we do have some tools on there that talk about ROI, but I can put it sort of succinctly like this. So imagine that a facility and we'll keep it simple for this, it's either a stroke or a STEMI facility. They've invested a lot of money in STEMI teams, and they've spent a lot of money on activating those teams, the cath labs, the angio suites that are necessary for stroke patients. And then you talk about how many times there may be a false activation. So everybody on the team gets some sort of notice that a stroke patient or a STEMI patient's coming in. They all gather themselves together. They get the suites ready. They get the providers ready. Everybody gets on board, and yet something happens. Either the patient goes to a different destination. They have a different determination. Something changes with the patient. And so all that time and energy and all those provider time and energy has been wasted. So just for false activations alone, it's a significant return on investment. The other thing that I would say about return on investment is we get this a lot. So I get the question, well, what if EMS isn't using it, but the hospital is using it? And so one of the returns on investment for everybody is this, is that if you can decrease the time of treatment by, and we do this by at least a third across our customer base, if you can decrease the time to definitive treatment by at least a third for all patients that come in anyway to your facility, then you in effect are getting a major return on investment in your institution, and you're getting a major return on value for and quality for the patient.
That's a great example, Joey. Thank you for sharing that. Next question here, this attendee is asking, what is the learning curve like with using this solution? What use cases have you found to be most effective for the Pulsara solution?
Yeah, that's one of the things that's really interesting about Pulsara. And if you saw my picture when we started this, I've been in the healthcare space for over 3 decades now. If you can order a pizza, and you could use any one of the modern platforms for social media, then Pulsara is pretty much simpler than that. And what we found, particularly during the pandemic, we onboarded hundreds of customers, both EMS and hospitals, hundreds, literally, in a day. And we provide online training for that. It's so ubiquitous. The experience on smartphones for everybody in our environment now is so ubiquitous. And what I like to say is the user experience is ubiquitous. So what they like to do, they get to do just like they do everything else. They get to do that on Pulsara.
Great, thank you so much. We have time for just one more question, and I think this is a great one to wrap us up here. This attendee is asking, what are the next steps if we're interested in pursuing Pulsara?
You can very easily go to the Pulsara website. You can actually sign up from the website. Just go to pulsara.com, and there's a link on there where you can actually sign up. You can submit your form to sign up. We get them all day long, actually, from people who just simply sign up from the website. So I'd encourage you to go there. There's plenty of materials as well there to help you understand more about the platform than I can cover in 30 minutes. And so just visit pulsara.com, and we hope to see you there.
Wonderful. Thank you so much, Joey. That is all the time we have for today. I want to thank you for an excellent presentation, and I also want to thank Pulsara for sponsoring today's webinar. To learn more about the content presented today, please check out the resources section on your webinar console and fill out the post-webinar survey. Thank you for joining us today, and we hope you have a wonderful afternoon.